Hi, it's Dr. Betty Robin with the Dentistry Rising podcast. You might know me as a dental practice sale broker from Orange County, California. I am a dentist as well as an attorney and broker, and it's my goal at this point to help you get where you want to go with your practices, to help inspire you, lead you in the right direction, and motivate you. So happy listening. Hi, it's Dr. Betty Robin, and thank you for joining me today. We're going to step back a little bit and talk about terminology in this podcast, production and collection, because it can be confusing. I hear a lot of dentists interchanging the terms production and collection, but really they're not the same at all. And I get a lot of questions from buyers and sellers that tell me they don't understand the difference and they are interchanging the terms. It is important. It says a lot about a practice and it tells buyers a lot. So let's clear it up. Production is how much money a practice posts in their computer system or puts on their books or logs in, or maybe how much they hope to collect. It's merely how much treatment the practice has done or has produced, hence the word production. Production is very different than collections. Collections is actual money in the bank. No hope involved. It's reality, and it shows on bank statements, tax returns, and computer reports. Collections are how much money the practice actually takes in or collects from the money it produces. That's why we focus on collections, because it isn't smoke and mirrors. It's reality. Collection may have a lot of other names, but basically it's the actual cash. When analyzing practice for sale, we do focus almost entirely on collections because that is the most important. However, production matters too and can tell a host of secrets. A buyer usually doesn't get into the production and the analysis of the production of the practice until they're well into their due diligence. In my opinion, it isn't really a starter type of question, which doesn't mean it isn't important and shouldn't be analyzed at some point. You absolutely should understand the relationship between production and collection in a practice you might be considering and what it's telling you. As a broad level example, a highly reduced fee practice like an HMO or Denti-Cal practice might produce in full fee terms $2 million a year as an example, but only collect $500,000 a year. And that would mean a reduced fee practice might be financially equivalent to a fee for service practice that produces only $500,000 but actually collects $500,000. Remember, bottom line, we are always very interested in looking for money you can take home. So we are talking about here top line collections as opposed to production after or before expenses. So note that in the $2 million practice, a whole lot more labor is required, a whole lot more supplies and lab bills are required to produce that $2 million. But we're not going to go too far down that road, but with the opposite is also true. With a fee-for-service practice, it doesn't take as much labor, it doesn't take as much supplies or lab bills to produce that $500,000. But the business model is entirely different. So I just want to make sure you know what you're looking at. Now, before we move on, a word about fee-for-service practices and a little more terminology. I define a fee-for-service practice, and I think it's the right definition, is a practice collecting the entire fee regardless of insurance participation. That's it. Very simple. If a practice is not collecting the entire fee, for whatever reason, it's not a fee-for-service practice. Sometimes people make exceptions for a fee-for-service practice saying it's fee-for-service with the exception of Delta. In which case, my question might be, how much of the practice is delta? Like 30%, 40%, 50%, whatever. But that practice is not a true fee-for-service practice. It's a PPO practice. There are actually very, very few fee-for-service practices, but the word is very overused. So again, recognize exactly what you're looking at and call it by the right name. Okay, back to production and collection. What does the production tell you? First, it usually tells you what kind of practice it is, as we've discussed. Is it fee-for-service? Is it Denti-Cal? Is it PPO? What is it? And remember, that can be important because you may not want to do a lot of work that you have to pay labor for, supplies for, etc., and not get paid. But you just want to be clear what you're looking at. It can also tell you how a practice posts services, which can be very important because it can tell you how well a practice is managed and what they're doing. Even if it's managed well, it could be managed in different ways. For example, our service is posted at full fee and then the procedure then adjusted when the insurance check comes in? Or how is it done? What if production and collection are almost the same? Then that tells you that the practice collects almost everything it produces and may be a true fee-for-service practice. Or the practice posts what it expects to collect. So a practice that expects to collect $700 for a crown under a certain PPO and it posts $700 instead of the regular fee of $1,500, writing off the difference later. So obviously it can be done both ways and you just need to know how it's done. And we'll talk more about posting in another podcast. Okay, so I hope this helps and I hope you clearly understand what's what with production collection and a fee-for-service practice. And it helps you make a better analysis of practices you're looking for. Thank you again. I'll talk to you next week. Dr. Betty Robin. Please subscribe on iTunes so we can get better and better at helping you make your practice dreams come true.